our Partners for Healthy Schools meeting for September. Our agenda today, we are going to start with some welcome and updates like we usually do. We have Sarah Maresh, who's here to talk about our Medicaid expansion, and we also have Vidi Almanza, who's here to talk about their Club de Niños Saludables. And then that'll wrap up our time together for today. All right, so to kick us off, we'd love for you each to share your name, the organization you're representing today, and then for some fall fun, your favorite fall beverage, and then any updates from your organization, projects that you're working on, or things that would be helpful for members to know about. So Sarah, would you mind getting us started with that? Whoops, excuse me.
Sure. Yes, my name is Sarah Marsh, and my pronouns are she, her, hers. I'm here with Nebraska Appleseed today. My favorite fall beverage is probably hot chocolate or apple cider. And kind of one of the big items that Nebraska Appleseed is working on is what I'm talking to you all about today, and it's Medicaid expansion and trying to get the word out to as many other folks as possible. And Nebraska Appleseed has a couple of different program areas. I'm sure a lot of you are aware of that already, but we do work in the child welfare area, immigrants and communities area, and economic justice and healthcare. So we're working on a variety of different projects and trying to, as well, like everyone else, deal with the COVID crisis.
Vidi, do you want to go next?
Unmute. Hi everyone, my name is Vidi Viana. Everybody calls me Vidi. I work at the Latino Center of the Midlands under the Family and Community Wellbeing Department. My favorite beverage, whether it be spring, fall, summer, winter, is Scooter's Caramelicious blender. So I love that. And the fall updates for the Latino Center, we're busy doing a lot of programming with our different departments: Pathways to Success, Adult Basic Education, which is now Workforce Education and Innovation, and then Family Community Wellbeing. Just doing a couple of campaigns, distributing food, focusing on food security. Thank you.
Awesome, thank you. Calendaria, do you want to go next? Candy? We can come back around to her. Sherry, would you like to go next?
Sure, yeah, good morning. Sherry Dickmeyer with Fit Girl Inc. Gosh, the beverage, what a good question. There's so many good fall beverages, but I think I'm old school. I like the hot apple cider. I do love all of the pumpkin coffees though too. So updates for fall. We actually yesterday kicked off our Empower You program, and usually in the past how we've run that is through group classes, but we did continue this past summer with our summer camps. We had 200 girls attend, which was great, but we did them all outdoors. 0 COVID cases, which we were very proud of. So it actually got us thinking. We let go of our facility and actually moved out to Waterloo at the Thrive Space, which we love out here. And they've got opportunities for us to do some classes out here, but we're switching to more of an outdoor program. So this fall, we actually have 25 Creighton pre-med students and 10 health and kinesiology UNO students, as well as some local high school students that are mentors. So they're actually going to facilitate one-on-one our curriculum this fall instead of us doing it as a group. So I'm super excited about it. I think it's gonna work well. Everybody's super excited, but it helps us mitigate the risk a little bit, gives parents ease of mind and keeps the kids active. And then we also had a small grant from Collective for Youth. So we are going to start programming in October in some of the OPS schools.
Awesome. Some great COVID innovation. Thanks for sharing.
Yeah, you're welcome.
Alyssa, would you like to go next?
Sure. My name is Alyssa Westling, and I am with the Nutrition Education Program with Nebraska Extension. And I guess I really like chai tea lattes. I drink them all the time, but they're more appetizing during fall, I guess. Other than that, we haven't been up to a whole lot, just with our kids being out of school and everything. We still have double up food bucks going on at the farmers markets, And if you'd like more information on that to share with your clientele, feel free to ask and I can share that with you. Other than that, we're just doing some virtual programming right now. Starting to get some stuff done with the schools, but for the most part, they're all still at home. So that's a little bit hard, but getting some stuff out there.
Awesome, thanks. Kathleen?
Kathleen Knutson from Raise Me to Read Metro Omaha version. There's also a Council Bluffs version. We hosted a showing of Resilience, the documentary Resilience, about adverse childhood experiences, and we had about 250 people from all over the nation, and we intend to sort of gear up on that, and that kind of goes with not necessarily the schools update, but the Wellbeing Partners study on adverse childhood experiences. And from my experience as a school administrator, I know that you can have the best teachers, but if you don't have relationships and you're not taking care of the kids, it won't matter. So we're working on that, and we also meet with the literacy leaders from each school district in the 12 of MOEC, and they are just reporting that they are at their past capacity. And so we're meeting with them again tomorrow afternoon, and mostly we had been doing with the Iowa Reading Research Center some training with teachers and administrators, and that's all put on the side burner, and we're meeting with the literacy leaders so they can just hear from one another about what it's like in all of their schools. And then the other thing we're working on, I'm like many in that we're just sort of waiting. I keep saying, put me somewhere. I can point parents down the hallway. I can do something. Put me back in a school. But we're working on an anthology of sources. A lot of meetings that I go to, people say, we know there's lots of wonderful things going on, but we're not sure what it is. And so we're working on that in our time while we're waiting to get back into schools.
Awesome, thanks. Maria?
Yes, good morning, everyone. My name is Maria Valadez. I'm with the Latino Center of the Midlands, and my favorite fall beverage, I think, would be chocolate, just a hot chocolate. And then updates, like Reedy mentioned, our different departments are doing different things. Right now, we're doing a lot with physical well-being, so with that food insecurity with food pantries. And I'm excited to be here. Thank you.
Thanks, Maria. And Kalendaria?
It says her mic isn't working, but she says good morning. And she's from the Latino Center as well.
Thanks for being here. Sorry about your mic.
Yeah.
Okay, is that everyone, or did I miss somebody? All right, I think that was everyone. I can share some updates from the Wellbeing Partners. Again, my name is Claire Brown, and I'm the Youth Wellness Coordinator for the Wellbeing Partners. My favorite fall beverage is definitely apple cider. I love hot chocolate, that's fine. Coffee's wonderful, but apple cider is a special place in my heart. So I'm always happy to drink that. We wanted to share today about our Exchange Summit coming up on October 7th. This is a conference setting that has some different tracks for business wellness, worksite wellness, and community wellness. So if that's of interest to you, we're happy to connect you to some more information about that. We would love to have you join us for the exchange. We also have recently published a physical activity in the classroom professional development series that was done in collaboration with UNO's College of Health and Kinesiology. Maybe remember from our last meeting, we had Dr. Dinkle here talking about physical activity in the classroom, and we were able to work with her to build out this really awesome professional development series. So if you are working with teachers or working in classroom settings and would like to view that, it can be found on our website. We can also put a link in the notes from today. Finally, we're always sharing out youth wellness resources and many from your different organizations on our Facebook page, the Wellbeing Partners-Youth. So if you are not following along to that page, we would love to have you follow us there. Please always feel free to share to your own organizations what we're posting there as well. We love that exposure. Claudia, do you want to share about your favorite drink and any updates I may have missed?
Yeah, so my name is Claudia Granillo. I am the Food Systems and Built Environment Coordinator for the Wellbeing Partners, which I previously held the record for the shortest title of the organization, and now I have one of the longest ones. It's rude. But yeah, my favorite fall beverage. I am also partial to the chai lattes, but I really like the pumpkin cold brew from Starbucks. It's delicious. It's like sweet, but also bitter. It's a whole thing. Try it. It's wonderful. And any updates? Share Our Table is our food security coalition, which Latino Center of the Midlands, Nebraska Appleseed, and Nebraska Extension are a part of. We will have a meeting in October 22nd, and if you're interested in learning more about Share Our Table, please contact me. I will put all of the details in our minutes for today. But yeah, thanks for coming.
Thanks, Claudia. Okay, so as we begin our presentations today, if anybody has questions, please feel free to type them into the chat, and I will read those out at the end of our presenters' time. Otherwise, I'm going to pass this along to Sarah, and she's going to share her screen for her presentation. I have to stop sharing first, so that's my bad. Okay, your turn.
Awesome, thank you. I'm working on it right now. Can you all see my slides? Perfect. All right, so my name is Sarah Marish, and I am a staff attorney at Nebraska Appleseed in the Healthcare Access Program. And so I am here to talk to you all about Medicaid expansion. And we're trying to get basically the word out to as many people as possible about this program. As we'll go into a little bit further here, we estimate that there are about 90,000 Nebraskans eligible before the pandemic for expansion. And so we want as many people to get out the word as possible. And we will have some outreach material and places to go for more information at the end here. But just to give a brief overview of our kind of talk today, first I'm going to just talk to you all a little bit about traditional Medicaid, just so we can all get an understanding of who is typically covered under your Medicaid without expansion, so we can see, you know, the type of folks who may be eligible under Medicaid expansion in Nebraska. And then we will go into specifically the Medicaid expansion plan in Nebraska. And just to give you a little preview of this, voters passed Medicaid expansion on the ballot initiative back in November of 2018. And enrollment has started, so that means people can go ahead and submit their applications. That started on August 1st of this year. But coverage for Medicaid expansion doesn't start until October 1st of 2020. So it's coming up, but coverage has not quite started, but people can go ahead and start applying for expansion. So just to give a little bit of an overview, Medicaid is a federal and state partnership. And so Medicaid is a program that provides healthcare coverage, medical assistance to certain groups of folks. And so Medicaid was adopted way back in 1965 at the same time as Medicare. And Medicare, of course, they sound super similar, so I like to go over the differences. Medicare is for folks 65 or older, or certain folks with specific types of disabilities. And so it's called a federal and state partnership because Medicaid's laws are set out at the federal level, and they say that states have to have certain mandatory services and groups of people that are eligible. And they also have to have certain categories of eligibility and services that are optional. And so Medicaid expansion is an example of the eligibility category that is optional, and that Nebraska and most other states have taken up as well. And just to give a little bit of a background, usually the federal government is responsible for a little over half of the program costs, what's known as FMAP of Medicaid. But Medicaid expansion is special, and under the federal law, the federal government from 2020 on pays 90% of the cost of Medicaid expansion, and the state only pays 10% of the cost. So the federal government is really paying a lion's share, and the state gets great benefits of having folks covered. So under traditional Medicaid eligibility, who is eligible? So without expansion, I've listed up here just the general, most common eligibility categories for folks eligible for Medicaid in Nebraska, but do note there are kind of more complicated categories as well. And so Medicaid eligibility is based on the federal poverty level, and that does depend on the size of your household. And so the examples I've listed up here are the income levels based on a household size of 3. And so when we look at this list of folks, we see pregnant women are eligible if they earn less than roughly $3,500 a month. Children are eligible if the families earn less than $3,855 a month. Then we have certain very low income parents earning less than about $1,050 a month. And then we have seniors and individuals with disabilities as well that are covered at certain levels. And so when we're looking at this list here, we see there are certain groups of folks that are just left out from Medicaid eligibility if they don't fit in one of these categories. And that is really what Medicaid expansion is trying to address. And so as we saw from the previous slide, Nebraska Medicaid only covers parents up to 58% of the federal poverty level. And we saw that's only a little over $1,000 a month. And so that is a really low coverage. And Nebraska Medicaid also doesn't cover childless adults at all. And then another piece of what we call this coverage gap is that under the Affordable Care Act, where folks can go and buy health insurance coverage, there are what are known as marketplace subsidies or premium tax credits you may have heard of that help people, moderate to low income folks, buy health insurance in affordable ways. And so unfortunately, those subsidies to help make health insurance affordable on the marketplace are only available to folks that make 100% of the federal poverty level or make above that percentage up to a certain point. And so if folks make below 100% of the federal poverty level, they're not eligible for those marketplace subsidies. And so that really shows what that coverage gap that we're trying to address is as well. So there's a gap in coverage for childless adults between 0 and 100% of the federal poverty level because they're not eligible for Medicaid, and they also are not eligible for premium tax credit and marketplace assistance subsidies. And parents between 58 and 100% of the federal poverty level as well have that similar gap there. And I would just mention too as well that Medicaid expansion, and we'll go into this a little bit more here, is focused on adults coverage. It's for folks that are ranged 19 through 64. But there has been evidence in other states of positive impacts on child's health care. And Nebraska is definitely on the tail end of states that have adopted Medicaid expansion. And so we've seen effects in other states that are associated with Medicaid expansion for what's known as the welcome mat effect. And the welcome mat effect just says that if parents have coverage, their children are more likely to have coverage. And there's also been evidence of Medicaid expansion associated with increased well child visits as well. And so coverage of more folks means coverage of more kids has been associated in these studies. And so specifically Nebraska's Medicaid expansion, I've already talked about a lot of this already, but it was passed by ballot initiative. Enrollment began on August 1st, 2020, and coverage begins October 1st of 2020. And that's almost 2 years after voters approved of expansion. And so we're trying to get as much information as we can because there are 90,000 Nebraskans eligible for expansion before the pandemic. And we've seen a couple of different estimates from folks, but it could be due to the economic downturn associated with COVID, thousands more that are eligible for expansion. And so specifically, the expansion group applies to folks who are aged 19 through 64 who earn 138% or less of the federal poverty level. And just to give you an idea of what that is played out for income per month, for a household of one, that's roughly $1,467 a month. And for a household of three, it's roughly $2,500 a month, a little less than that. Of course, folks for the expansion group also have to meet other general Medicaid eligibility requirements as well. And just a couple other of notes on the expansion group. Medicaid expansion applies to eligible adults with or without children. And there is no asset or resource test, unlike other types of Medicaid. So certain types of Medicaid require an asset or resource test, and Medicaid expansion is not one of those categories. So there's no asset or resource test. And folks in the expansion group, like most other types of Medicaid, will be enrolled in the Heritage Health plans or the managed care organizations. And unlike other types of Medicaid, if folks are eligible, they will be either enrolled in prime coverage or basic coverage. And so the prime and basic coverage, so when someone is deemed eligible for Medicaid expansion, they will either be put in prime coverage, which includes all Medicaid benefits, including dental, vision, and over-the-counter drugs, or they will be put in that basic coverage that does not have dental, vision, and over-the-counter drugs. And so the groups that automatically receive prime coverage are those who are medically frail, 19 and 20-year-olds, and pregnant women eligible under expansion. And so two of those characteristics are pretty self-explanatory. 19 and 20-year-olds get prime coverage and pregnant women eligible under expansion. But what is medically frail? And so the department has put out a definition of what is considered medically frail. And I've listed up here the categories of what may qualify someone as medically frail. And we won't go through them all, but basically there are certain health conditions, including mental health conditions, and it can even include chronic homelessness as defined by the U.S. Department of Housing and Urban Development as well. And so to be deemed medically frail, to get that prime coverage, so that includes the full Medicaid benefits, the dental, vision, and over-the-counter drugs, folks go through, in most cases, a determination process with the department. And so to go through that determination process, folks can self-identify as medically frail, to be evaluated for that medically frail status and prime coverage. Their managed care organizations can flag those folks, or the department themselves. And judging by the fact that a lot of, the qualifiers for what would deem you as medically frail are related to your health, it may require documentation from providers. There's also a non-exclusive list of conditions on the Department of Health and Human Services website and other information on their medically frail page that helps give a little bit of a picture as to what would constitute medical frailty. And the determination of who is medically frail is ultimately made by the department, and they will determine whether you receive that prime coverage if you are eligible under expansion on that. And one other note I would flag on this as well is that the medically frail determinations can last from 1 year to up to 3 years, depending on the medical status that qualifies you for that medically frail determination. And you can find more information about this medically frail process on the department's Medicaid expansion website, which I'll provide in a few minutes here. And it does include a dedicated page on medical frailty. So this stuff is kind of complicated, kind of going through this new process since it doesn't apply to any other type of Medicaid. And their resources can help provide some guidance on that. Next, I wanted to pivot a little bit, still talking about Medicaid expansion, of course, but you may have heard the department talking about a waiver or some requirements that they would Medicaid in group. And just to be clear, these requirements are not going into effect at this time. And that's because they have to be approved at the federal level. And the department has told us that due to COVID, the federal government has delayed in approving their waiver. But it's our understanding that the department is still pursuing a plan through a federal waiver that does include imposing work and wellness requirements on the expansion group. And those would be evaluated every 6 months. And so, of course, this waiver is not yet approved, but if it does get approved, unless exempt, expansion enrollees would have to meet 7 separate requirements to get prime coverage. And so we talked about the folks that are automatically in that prime coverage, and that includes the 19 and 20-year-olds, pregnant women eligible under expansion, and medically frail. So these requirements would not apply to those folks, but they would apply to the remainder of the folks in that basic group unless they're exempt from some or all of these requirements separately below. And I won't go through all of these, but this is just to kind of give a picture, to paint a picture of what may be coming down the pipeline in the future as well. And a couple of things to flag on this, it can require folks to in the second year of the program meet work requirements. And it can also require folks that they cannot miss 3 or more appointments in a 6-month period. And so this is something, again, not going into effect now, but may be coming down the pipeline in the future to keep an eye out for the expansion group. All right, now shifting to enrollment information. So there are a couple of different ways that folks can enroll expansion, just like regular Medicaid. And so they can contact Access Nebraska, they can go online, they can call that number, and they also can apply in person and through paper application as well. And we also wanted to flag that if folks have questions and want someone to help them walk through that application, there's also free assistance available through Enroll Nebraska's Enrollment Assisters. And I've listed the website there where you can find more information about that as well. So Nebraska Appleseed and Enroll Nebraska have also put together an outreach toolkit to help spread the word about expansion. And some of you may have seen this before, but that link is available there and will be available in your slides. But the outreach toolkit includes a lot of basic information. It has a fact sheets, a bunch of templates to help spread the word out, and apply now postcards in both English and Spanish. The Department of Health and Human Resources also has a dedicated page for Medicaid expansion. And so I've listed that website up there. And that does include a lot of different information as well to help folks get informed about Medicaid expansion. And they do have fact sheets, frequently asked questions, and other sorts of flyers and type of postcard or rat card materials. And those are available in both English and Spanish. And I think there's a way that you can request some of those materials as well on that website. And of course, that website also includes specific information that I talked about the more complex medically frail process as well, if folks are interested in learning more about that. And if people have general questions about Medicaid expansion, they also have a dedicated expansion email listed above here as well. So that is all I have prepared today, but if you have any questions, I'm happy to answer them now. And I also have listed my email up in case folks have questions in the future as well.
Thank you, Sarah. If anyone would like to turn your mic off and turn your mic on, excuse me, and ask a question, you're welcome to. We did not get any in the chat box right now though, so I'm not gonna read any off for you.
Okay, that sounds great. Yeah, and as like I said, feel free, my email's up there, feel free to reach out to me if you do have any questions that come up in the future.
Awesome, thank you. All right, Sarah, if you want to stop sharing your screen, and then we will switch over to Vidi if you're ready.
Okay, let me see.
Awesome.
Can you guys see this?
Yep, that looks great.
Okay, perfect. Oh, I don't know what I did. Oh, I stopped sharing.
Nope, you're still sharing. You're good.
Okay.
There you go. Yep.
Perfect. Okay. So I'll be sharing a little bit about first of all, thank you for inviting us. I don't know what's wrong with me today. I'll be sharing a little bit about the Healthy Kids Club, or our Club de Niños Saludables. I'm here with Candelaria Velázquez, who is our youth specialist leading this project, and then Maria Valadez, our department coordinator, who supports us as well. This is a program that's implemented at the Latino Center, and we follow the 5-4-3-2-1-GO curriculum. So just a little bit about the Latino Center. As many of you know, we are here to support the Heartland Latino community through education and development of our youth and adults. We really promote comprehensive engagement of our families in all aspects of their lives, and we foster leadership through a variety of services and activities. Specifically, the Family and Community Wellbeing Department, our purpose is to provide social service assistance, as well as wellness education, focus on nutrition, physical and mental well-being. And we do this through interacting directly with our community and by partnering with expert organizations such as many of you. Quickly, some of you may have heard of 5-4-3-2-1-GO, so I'll do this briefly. The curriculum really focuses on ensuring that we all know that we should have 5 servings of fruits and veggies a day, 4 servings of water a day, 3 servings of low-fat dairy a day, 2 hours or less of screen time a day, which is really challenging for our youth right now, and then 1 hour of physical activity a day, also challenging given COVID. 54321 Go was developed by the Consortium to Lower Childhood Obesity in Chicago, and really the focus is to promote and encourage kids to live a healthier lifestyle through mindful eating, the nutrition component, and then physical activities. Some of our partners include the Wellbeing Partners, which we actually were going to do the Catch curriculum, and then we couldn't because of our physical space at the Latino Center, so we were very blessed to have come across the Wellbeing Partners and the 54321 Go curriculum. We also partner up with the University of Nebraska Omaha, Department of Health and Kinesiology, Zumba Corporation, Whispering Roots, Nebraska Extension together, and then we are primarily funded by Children's Hospital and Medical Center. And if I'm going too fast or if you have any questions, please let me know. Our program participants I've separated into 2 sections. First, we really support our adult basic education students at the Latino Center of the Midlands. We found that one of the biggest barriers for our adult students attending classes at the Latino Center or registering for classes was that child care component. So we decided, why not have the kiddos be learning something that will be helpful for their future and their present while their parents are doing the same. We also support families in Omaha who are just interested in having their kiddos learn and participate in nutrition and physical activities. Our participants themselves, we primarily serve youth that are between 4 to 14 years old. Most of the kids that we served last semester were from 4 to 10 years old. Most of them were Latino Hispanic, being bilingual in Spanish and English. So our activities most of them were bilingually led in Spanish and English. Most had not been exposed to the 54321 Go curriculum, especially that nutrition component. And here I'll start talking about some of the activities that we did during or pre-COVID. So we promote mindful eating and physical activities through cooking demonstrations, and these are big meals that we partner up, bring a chef from Whispering Roots, and our kiddos actually get to learn how to cut veggies and taste them before the meal is done. Healthy snack demonstrations through Nebraska Extension, nutrition education, awareness activities. We have Zumba days, we have yoga days, we have other physical activities that are led by UNO practicum students. And then we have the 54321 Go activities such as goal setting. And something that I'm really excited about, or was really excited about, was that UNO students actually mentored the youth. So they came on a very consistent basis, met with the youth and talked about, well, what about today? Have you had your at least 1 hour of physical activity, or something related to the 54321 Go curriculum? These are just some photos of our nutrition activities. We found out that peer pressure amongst kids could be good when it came to trying to test new veggies and fruits. We also, like I mentioned, collaborated with Whispering Roots to do meals. The kiddos got to interact and engage, and they really actually loved that. And then we just did other fun activities related to fruits and veggies and nutrition and eating healthy. Some of our physical activities, some photos of Zumba stretches before Zumba session. We also did other activities that were led by UNO practicum students. They each developed a unique activity for the day or topic for the day based on the 54321 Go curriculum. We tried really not to focus on games because there was a lot of feelings hurt. However, we tried to make it more individualized so that they could do the activities at home or alone. We also provided the nutrition snack education or demonstrations. But alongside that, Claire Brown from Nebraska Extension talked about My Plate, which was really the nutrition awareness portion of our curriculum, which we're really glad that that went along with the kiddos eating a healthy snack. And then other activities that we do with the Healthy Kids Club, our main focus, like I said, is implementing that 5, 4, 3, 2, 1, go curriculum. And we have our UNO practicum students who actually helped us develop the manual exclusively for the Latino Center of the Midlands, or not exclusively, but tailored towards the Latino Center of the Midlands. But we also invited other community partners to come talk to the kiddos. Either we have MUD who came to talk about water and filtration and the benefits of drinking water. We also had somebody from the Omaha Police Department, Officer Alcantara, come and talk about safety. The same with the fire department. And then we occasionally have fun activities, or in this case, the photo that you see at the bottom is of our semester celebration. If they meet most of their goals and attendance, the kiddos received a sports ball so that they could, do something in that was right before Christmas or winter break. So we want to ensure that the prices that we give are things that are going to help them be active or eat healthy. Our response to COVID-19, it was challenging. Our adult basic education classes were canceled in person. However, they did move to online, so we decided to do something similar. Our plan B was to conduct weekly calls to the students and to the parents or adult members of the household and talk about the 5, 4, 3, 2, 1 curriculum. So each week we picked a different topic, talked about it for a few minutes with the parents or adults, talked about it with the kiddos, and then at the end set up weekly goals based on the 5, 4, 3, 2, 1 go curriculum. A week afterwards, we would check on the parent and see, hey, Mario told us that he was going to see use less of his cell phone this week. Did you observe any change? And then we will ask the kid too, hey, Mario, did you actually meet your goal? How close were you? And then just use that as motivators to ensure that they were keeping healthy throughout COVID. And so the purpose of the calls was really to ensure healthy eating habits were continuing at home, and then continuation of those exercises or physical activities or movements at home. We also had the opportunity to continue our cooking demonstrations with Whispering Roots. We did this through a Facebook Live, and we encouraged all of our families to attend the Facebook Live video. If they didn't, we were able to share it with them afterwards. And this was really to promote kids and families working together to cook a healthy meal or talk about healthy meal preparations. Along with that, Together was able to provide each family with a box of ingredients for them to replicate that recipe at home or to create their own healthy meal at home. And so we were able to get photos from those kiddos. We encouraged the families to take photos while they were cooking or the end result meal. So you can check that out on our Facebook page, Latino Center of the Midlands, or on just on our Facebook page, I believe. Other things that we did to prepare for COVID was that we turned each 5, 4, 3, 2, 5, 4, 3, 3, 2, 1, go. Sorry for that. We turned all of those themes into PowerPoints that we could share with our family members so that they could see at home. We also had PowerPoints based on healthy food and drink options, exercises that they could do at home. UNO students prepared a whole bunch of documents of activities that they could do, games that they could play. We had fun facts for them. And then we were also able to create videos. Our Zumba instructor was also able to create videos of Zumba or dancing exercises for the youth. And then brief demonstrations of nutritious snacks. And these can be found, most of these can be found at the latinocenter.org, our website. and Facebook page. And then last but not least, an activity or another activity that we did, and this was more for the summer, was that we created a manual of activities based on the 5, 4, 3, 2, 1, Go curriculum. So the manual had a brief summary of each of the numbers and what they stood for, what they meant. And then along with that, there were word searches, fun ways to exercise or activities, mazes, coloring pages, goal setting, and healthy recipes that they could eat that went along with each theme. And that every time they completed an activity, their parents would have to sign, so that by the end of the summer or by the end of the completion of the manual, they could receive a healthy prize. We, of course, do evaluations based on the curriculum, but we also try to take some or do some testimonials. One of the questions that we asked was, during the time your child attended the Healthy Kids Club, have you noticed any changes in your child's nutrition or physical activity? And so I like to highlight the one that mentions, when I go to the store, my kids ask me to get vegetables like broccoli. I never remember asking my mom for broccoli, but you know, that's a good indicator. And then during the time my child has assisted the Healthy Kids Club, she has been more active. So we like to see those kind of those types of testimonials, just ensuring that we are on the right path. And then currently we are not offering the Healthy Kids Club. We decided to go along with OPS policies and regulations in terms of COVID. So we are just hoping that, you know, if they make a change, we will do the same. The club is expected, however, to resume once it is safe to do so. And we're really excited because, like I mentioned at the beginning, that barrier for our adult basic education students is huge, and we want to make sure that that barrier is lowered and that we focus on, you know, creating a healthy future for our kiddos. Meanwhile, though, we are still continuing to support our families and youth through our COVID-19 campaigns. We started off with our fruit campaign in association with Nebraska Heart Association, in partnership with Nebraska Heart Association. And that focus was really to deliver fruits to our community members. I think we got close to 300 deliveries that we made, but then also have documents and information about why it's important to eat fruits and consume them, and prevention and all those type of things. We've done a COVID-19 resource and safety campaign. We distributed over 150 sports balls and food security pantries alongside with Nebraska Heart Association as well. And then we are still continuing to focus on food security distributions, pantries specifically. And then we're also working on our mental health, distributing our mental health kits for our families. So that's just a brief overview. If you have any questions, I'll put my information on the chat, my email, my contact information. Otherwise, I'll be happy to answer any questions. Thank you so much for your time.
Thank you, Vinny.
I'll pass it over to you.
Okay, thanks. We did not have any questions in the chat, but if anybody would like to ask one, feel free to jump on in and ask a question.
I don't really have a question, but it just seems like you transitioned to online so effectively, and I loved the idea of showing the video online and then providing the kit to parents. I mean, that's just really on the ground stuff that you've managed to sort of mix the virtual and then getting the information to them world. So I just really appreciate that.
Thank you.
Yeah, you guys did a great job. You had a lot of hurdles, but you handled all of them very well. Congratulations on your program. All right, well, if anyone does have questions, you're always welcome to email our presenters or Claudia or I. Our contact information is down here on the bottom of this slide. We'll have another PHS meeting this winter, excuse me. So if you have suggestions of a presenter who you would like to have present or a topic that you'd like to learn more about, feel free to let us know and we'll work on that for you. Any closing comments before we wrap this up from anyone? All right, well, thank you all for your time live here with us today, and thank you for your time if you have watched this recording at a different time. We look forward to connecting with you again in the future. Have a great
Thanks,
afternoon.
everyone. Have a great day.
Thank you, everyone.
Bye. Thank you, Sarah.